your testing kit, your insulin kit, your pump, which is the main thing. Insulin vials, you've got to remember tubing, you've got to remember antiseptic wipes, you've got to remember everything.
You've got to remember to test every time you eat, which I think that's quite hard, really.
It's constantly on your mind, like for me, when I eat something, you got to do it. Exercise, it's like every little thing you have to think about it for me.
I've had them lots of times. It's like when your blood sugar's low and high.
It's like a feeling where you're like in a room full of white cardboard and your legs like jelly.
Everything gets under my skin when I'm high. I get really frustrated, and even when someone's just talking to me, I'll snap.
I'm a bit silly. I act a bit naughty in class.
Is not being naughty. It's part of the condition and it's beyond their control. They don't mean to do it.
There's so many variables that can cause a hypo. With the best will in the world, you can do everything by the book. But if the weather's warmer, they can go hypo, and you have no control over that.
A lot of school staff are very frightened about diabetes because they generally have little or no experience of it.
You've probably got 29 other people in the classroom. You've got to get through the syllabus. You've got to get everything across to them. I think more training definitely for teaching staff.
Good care makes such a massive difference. You can't even get that across, I think, how much better you feel. The first meeting I went to with Nathaniel's high school teachers, I came out and I cried because finally I'd heard all the things from the teachers that I'd wanted to hear for years and years and years.
When Alicia was first diagnosed, I was going into the school to do her injections. Then the diabetic nurse went in, trained 3 of the staff to do her injections.
I went on a residential trip in year 7. My school tutor downloaded the Carbs and Cows app. She wanted to know about diabetes and she wanted to know what she could do to help me, which was good.
When Max started his new school, it was a busy day at school, but they managed to find, I think it was about a dozen staff, various teachers, special needs, receptionists, first aiders, and they all sat down and they just looked at us and said, what do you want us to do?
They let you test, like, any time you need to. They won't stop you at all. They'll encourage you to test.
I really appreciate my TA telling other staff how to do it, so if he's away I feel a lot more comfortable with other staff because they know how to look after me.
I care for Alicia when she's at home, and once she leaves my front door I do worry till she gets to school, but I know once she's in school she's in safe hands.
Well, to look after a child with type 1 diabetes, what needs to be in place in a school is a medical conditions policy, each child to have an individual healthcare plan, there needs to be training for the school staff, and there needs to be working together, and that involves the school, the parents, the child where appropriate, and the paediatric diabetes specialist nurse.
One-on-one communication is often the key. A lot of the time there will only be one person at the time looking after Lewis. So it's important that we get to see how they feel as well about things.
Alicia's got her own care plan that the diabetic nurse set up when she was first diagnosed, and it gets reviewed whenever anything changes, and the diabetic nurse will go into the school and I'll go in and we'll sit down with the first aiders, and it gets done that way so everybody knows.
Diabetes UK produce packs for both schools and parents to help them support children with diabetes in school.
There's great information on the website that's really easily accessible for schools to look at what care should be provided for children, and it's very clear and concise and readily available, easily accessible.